Right. So could we just start by you introducing yourself, just saying your name, your occupation, and where you practice or practiced?
Hi, I'm Clare Stiles. I am the Acting Child Health Manager for NHS Shetland. I'm a health visitor by background, but I've also been a district nurse and a midwife, and combined all three as a triple duty nurse at one point in my career as well.
Thank you very much. So could you just describe the hospital or surgery, and I realize there may be multiple ones, where you practiced, the sort of numbers of staff and the sort of setup that there was?
That's very difficult because I've worked across many, many areas in Shetland. My main area of practice was in Yell, which is one of the more remote islands connected to Shetland mainland by a ferry. And there was a single-handed doctor there when I started, with one receptionist and one secretary. And there was myself as a triple duty nurse, and there was a double duty nurse as well. And that was the makeup at that time. And since then, the dental team have joined, extra clerical staff have been needed to join, a practice nurse has joined the team. The team has expanded quite considerably. But I've worked in many other areas as well. So I've worked on what we call the non-doctor islands, which are the very remote ones. So Skerries and Fetler are two of those islands I've worked on. And there isn't a doctor, there is a nurse's house and a little surgery, and that is it. And quite often there wasn't any broadband or anything for computers to work. And it quite often involved, well, Skerries was a 2.5 hour journey there on a boat that made me feel sick every time, and the same back again.
Fantastic. Thank you very much. So, I mean, you've slightly touched on this question already, but are there any particular challenges that you faced in your work that you think are unique to somewhere like Shetland, or more common in somewhere like Shetland?
Geography is a huge issue in Shetland. Getting to and from different practices is quite difficult, and transporting patients who are not well. If you're not well on one of the non-doctor islands, you will quite often have to wait for a plane, which might take a long time. On the other islands, you might have to wait for an ambulance that's just got a normal member of the public driving it. There's no paramedics. So access to services is difficult, and services access to people is difficult. Health visiting used to be very much based in clinics, and we're now very much based going out into the patients' homes. But of course, that takes us an awful lot of time to do that.
Thank you. So have you worked outside Shetland or out with Shetland at all?
Yeah, my career started in England, because you can probably hear by my accent I am English. And I worked in big cities and big hospitals, and then became a midwife. Moved down to the south coast of England as a midwife and worked in the hospital and the community, and then came up to Shetland. So I've probably got, how many years experience before I came here? Probably got 6 years of experience in England before I came up to Shetland.
Thank you. So, and I realise this is possibly a slightly impossible question, but having worked in big cities, as you say, what sort of contrast did you see beyond just the volume of people, I assume, but were there any sort of differences in practices between the two?
I'm a country girl originally, so I'm from the Peak District, and grew up in a small village where people knew each other very much and cared for each other. And obviously in the city, that it's not as easy for that to happen. So I found that people didn't treat each other with as much respect. So coming up to Shetland felt very much like coming home again in a lot of ways, in that people were treated with respect and spoken to nicely on the whole. So that was the main difference for me. And I was probably used to having problems accessing services from being in the countryside, and I've sort of gone back to that again. Whereas when you live in the middle of Sheffield, which I did as a student nurse, you can hop on a bus and get to everything. There are lots of different specialities that you can easily access. Whereas in Shetland, you might need to get on a plane. You might have to actually travel the day before your appointment. So sometimes it can take 48 hours to have a 10-minute appointment with a consultant.
Thank you. So, given all these challenges, are there any particular medical complaints which are significantly more common or significantly less common in Shetland than you might see on the mainland or in a big city?
Now, I'm having to go back in my memory for this because I very much deal with child health at the moment. But my memory from when I was district nursing was we had quite a high degree of obesity-related diseases, I would say. So we had people with high blood pressure and therefore strokes, cardiovascular problems, heart attacks, things like that. So that was definitely an issue, but it's a while since I did district nursing, so things may well have changed since then.
Thank you. So kind of following on from that, without giving obviously any sort of personal patient details or patient names, can you think of any examples of treatment or conditions which were particularly sort of representative of the challenges in Shetland? So whether it's geographical or medical challenges?
To think back to one particular example, a friend of mine had a car accident in which he fractured his spine, but he was actually kept in the local hospital for treatment, whereas if he'd been living in mainland Scotland or mainland UK anywhere, he probably would have been transferred to a spinal unit. But of course, there's the risk of, if you move him to transfer him to a spinal unit, are you going to cause more damage by doing that?
Thank you. So do you think there are any particular challenges which patients face in this sort of environment? So not thinking of medical challenges necessarily or diseases, but challenges in receiving treatment or maintaining treatment because of the geographical problems, or are there issues around or challenges around staying healthy more generally in somewhere like Shetland?
I think staying healthy generally can be quite difficult. Nowadays, we do have a decent co-op and Tesco's, so there is fresh fruit and vegetables coming up every day. We tend to find some of the more country shops don't have as good a range of fresh fruit and vegetables, and I understand that's because of demand. But that means that the people who live out in the periphery who don't have transport may not have access to lots of fresh fruit and vegetables. There are quite a few leisure centres around with fitness suites and all that sort of thing. That's not everybody's cup of tea. And you may well have to drive 10 miles to get to your nearest one like I do. And the facilities are quite limited, but they have to be because they're small and it's for a small community. The weather is a particular challenge when it comes to keeping healthy as well, because a force 10 gale with sideways rain, you really don't want to go out for a walk on those days. And you can get days and days and days like that. So it's easy to get out of the habit of exercising on a daily basis.
Thank you. So before I move on, I wanted to ask a little bit more about what you said earlier about working on the non-doctor islands. I think it was Fetler and Skerries, you said. And I just wanted to, because obviously some people who are watching this won't have a clue what those places are like. I just wondered if you could talk a little bit about, what that experience was like. Do these places have sort of shops and amenities? How does the nurse fit into that community?
Right, so there would be one resident district nurse. So I was going in as a health visitor, because obviously that's a speciality that a lot of district nurses don't have. And that district nurse is resident on the island and provides any emergency care, any nursing care at all, and is usually provided with a health board house, which has a little surgery attached to it, a little clinical room. And I think Fetler has got one shop that is very part-time. And Skerries, I believe, have still got 2 shops. And the ranges in those shops are very limited. I think they both can act as post offices, but not the big post office. So you can't have all post office services, basically. You can post a parcel, and I think that's probably the extent of it. No banks, obviously, no ATMs to get your cash out of the wall. And I'm trying to think, neither of them have petrol pumps or diesel pumps or anything like that. So presumably people had to go to the mainland, fill the car up with diesel and use it and go back for more. I could be wrong with that. There's not an awful lot of employment. And because of that, the young families tend to move away. So there aren't many children. So the age group is disproportionately older folk with nobody to look after them. So there's therefore problems providing social care because there's a group of people of the right age to be providing social care supports to the older generation. So we're tending to find that the population is dwindling very rapidly.
Thank you. So the other thing I particularly want to ask you about was, obviously you mentioned at the start that you were one of the last triple duty nurses. And I was just wondering if you could explain a bit more about what that means and what that entails.
Right, so a triple duty nurse is a nurse who's a registered nurse to start with, and a registered midwife and a health visitor. And I included school nursing in that portfolio as well. So it meant that for my caseload, which was half of Yale, that I was everything for them in terms of nursing. So the family could not get away from me. So whether granny had leg ulcers that needed dressing and mum was expecting a baby, so I was her midwife, and she'd have a 2-year-old, so I'd be the health visitor for the toddler, and I'd be the school nurse for the 8-year-old as well. And if dad had high blood pressure, I'd be seeing to that as well. So you were really doing everything. And it was a really fulfilling job. It was wonderful. The problem was it was really hard to keep up to date with everything. And I don't know if you're aware, but in nursing, things change so rapidly. And current advice changes. There are so many guidelines and policies. It was almost impossible to keep up with everything and be safe. And that dissolved in the early 2000s, I think. Probably would have been about 2008, 2009 that it dissolved and things were separated.
Thank you. So that sort of nicely leads on to my next question, which was about, what were your sources for information and what sort of support network did you have as a nurse somewhere like, I shouldn't keep saying nurse, I should know better. A triple duty nurse somewhere like Yale, what was the support network and the training like?
Yeah, the support network was really colleagues who were round and about, and whether that was local or whether that was from colleagues who I'd met years ago working in England. The training for the district nursing and the health visiting I did by distance learning with the Robert Gordon University in Aberdeen, which did mean going down for sessions for a week at a time for each module. So I was able to create a network then. And in those days, it was old-fashioned telephone, quite frankly. I think emails hadn't quite come in at that point. And then, of course, when emails came in, we're then able to share information by email. Since then, I've become a Queen's nurse, and the course for that involved away days. And we've got a WhatsApp group and support each other through that. So through my years and years of nursing, I've developed this huge network of people with all sorts of different specialities and different jobs and interests, and keep in contact with them and dip in and out as I need. And they do the same with me.
Fantastic, thank you. So I was wondering if you could just explain a little bit about the work that you're actually doing now.
Right, I manage the child health team. So that is all the health visitors, the school nurses, the children's nurses, children's outpatient department, and the children and adolescent mental health service. And in amongst that, I've got a paediatrician, I've got a consultant psychiatrist and a consultant psychologist as well. And of course, I manage the clerical teams that go along with all of those services.
Thank you. So now I'm going to ask you questions which are a bit more broad about your kind of general views on remote and rural medicine in a place like Shetland. If there are any questions at any point that you don't want to answer, please feel free to say so. So are there any particular skills which you think are particularly necessary for someone working in medicine in somewhere like Shetland that maybe wouldn't be so needed elsewhere?
I'm actually doing a master's degree at the moment, and I'm researching health visitor prescribing because most health visitors are trained to prescribe but choose not to. There isn't a huge call for it, but I do regularly prescribe. So I've been examining why health visitors don't, but I do have a feeling that in the remote and rural areas, it's more important than in big conurbations, big cities. It's the patients tend to like it. They don't have to tell the story to another person, and they respect that practitioner for prescribing for us. So that is a little obsession of mine. You'll have to forgive me for speaking about that. There's probably so many. Probably the big skill is you have to be flexible. And you have to understand your client group and be able to develop really good communications with them, and understand that somebody may not be able to see you on a particular day because they're having to travel to the other end of the island for something completely different. And there's something about being very patient-centered, patient-focused, and thinking about their needs rather than what your service needs.
Thank you. So I wondered if you have any comments on issues which remote and rural sort of medical practitioners and trusts face. For example, I believe there are challenges around the recruitment and retention of staff in areas like Shetland.
Yes, recruitment and retention of GPs is a big problem. So we're tending to have to work with a lot of locum GPs who obviously haven't been through the vetting process of interviews and all that sort of thing. We had the big problem with recruiting qualified health visitors a few years ago, and we decided to move to a different model to actually grow our own health visitors. So the health board had not been keen to pay for the training. It is quite expensive to employ somebody as a nurse while you're training them to be a health visitor. But I was actually managed to put a business case together to show that it's actually more economical to do it that way. If you train your own nurses as health visitors and they're already resident here and they're happy and they've got a family here, they tend to stay. Whereas we would recruit health visitors from Scotland and England, and they'd move the whole family up and we'd have to pay removal expenses and all that sort of thing. They'd stay for a year or two and then leave again. So we've actually found it economically much better. And the girls just fit into the team much better as well. They're used to the pace of life. They're used to how systems work. They're used to the transport problems, all that sort of thing.
Thank you. So do you feel that doctors and nurses have the sort of support and voice that they need when decisions are being made? So if decisions are being made about funding or the rules around processes and things, maybe those decisions are happening in Aberdeen or Edinburgh. Do you think that Shetland's voice is represented in those conversations?
I do, in that we do have a very good director of nursing who consults before feeding opinions in. It then probably depends on that manager how far they've consulted with their team, but there are certainly channels to allow for that. And I think it's very important to get everybody's opinion and feed that back.
Thank you. So we're coming to the end now. This is the last question. So, you know, imagining a sort of fantasy world where money is no object, what would you like to see happen in Shetland? What were the kind of changes that you think would really make a difference?
From a service point of view, I think bridges or tunnels to all the islands would make travelling a lot easier. And for, you know, it may seem funny, but for example, if somebody is ill in one of the more remote islands like Yellow Runts, and they travel by ambulance to the mainland of Shetland, when they get off that first ferry, they are then transferred in the driving rain and wind from one ambulance to another with no protection, no shelter, nothing. And I think that is awful in this day and age. And there should be a better way of doing it than that. I understand that the ambulances on the islands can't be fully equipped. So it's not a point of swapping drivers, but it just seems brutal to do it that way. So I think, you know, a better access for the ambulance service would be better. That's probably the main one I can think of at the moment. We could do with really good broadband and having laptops that we could all carry around with us and full mobile phone coverage, because obviously that's a concern when a member of staff goes out to a very remote area and they don't come back until the end of the day. You don't know what's happened in the middle of all of that if they're outside reach.
Fantastic, thank you. So I'm essentially done with all my questions. Is there anything else that you would like to say that hasn't been covered?
I suppose the only thing is it's been really interesting to watch the health board develop over the last 27 years. So when I first came here, there were very few managers. There was very few administrative staff and administrative things we had to do. We now have to send a lot of data to government policy, government boards. And I completely understand why we had to justify our existence. But that seems to have meant that we've had to create more managerial posts with more clerical people. And I feel that the proportion of spend on clinical work is actually getting less in comparison. And that's not a criticism of the health board at all. They have to do what they have to do. It's probably the NHS as a whole, I think, is getting quite cumbersome